This is another area that could be used for outpatient clinic, and it's quite acceptable. If push comes to shove, we could have temporary clinics or wellness clinics or any other aspect of health care tied in with the hospital. But the emergency room is the most important thing. The x-ray and the lab, and then some holding beds are the things that would be most important for health care in this area. And this is an example of an area that could be used for beds or holding equipment if you didn't want to open up or had no use to open up the entire hospital. And this was the thing that astounded me just the other day. A person that had worked in this hospital for years and years told me that there was mold and mildews and tiles popping up everywhere, and I haven't seen that. Back here is the surgical suite, and you see you have another capability of having beds and holding areas, outpatient procedures and surgeries, and this would be an ideal area to reopen for outpatient clinic purposes. It would be really good. And this is a storage room. It's been partially stripped, or our equipment and items moved away out of there, so nobody knows where all of this stuff is gone. This is a scrub room before we go into the operating room here. Y'all can cut those lights off or on as you see fit. But this is your operating room. And still a very modern facility to doing simplistic surgery and outpatient procedures could be here. I've done hundreds upon hundreds of cases in here. And then across here, again, you got a kind of a nursing station, operating room. Here was our endoscopy suite, in which all three doctors here, Dr. Jones, Dr. Beamer, and I, all did a lot of endoscopy, upper GI endoscopy, colonoscopy, esophagogastroduodenoscopies, and also we did PEG tubes, put stomach tubes in here, and we had the capability of having the x-ray right at hand. So this was a very active part of our hospital, was an outpatient department. These services are just missing now. Oh, how you been? Fine. And again, this is the waiting area when people were coming in for the endoscopies and outpatient procedures, and this was a nice waiting area.
What do you think, Eunice?
I think we had a nice little hospital.
See if we can get it out.
We're gonna get it back. It's a
And now
shame
we're heading
we have
out
to go through all this.
towards the front.
A ceiling tile's down. That must be the one they've been talking about.
And again, we've got
One ceiling tile.
this was the foundation room where people donated a bunch of consulting room here, a prayer room for our patients and their families to come and have conferences with their doctors or with their families and their ministers. Monies for all of this were raised through the foundation, and the foundation has been a very important part of our past history, and we've always had outstanding support from the foundation and the people in the community.
And all the pictures of foundation, I think it was our last contribution, that $15,000 for all the pictures are all going.
Physical therapy was really quite active, because not only did we have people coming in for routine physical therapy, but we had our rehabilitation for the hospital for people we accepted here in our swing bed who had knee prostheses or shoulder surgeries or back surgeries and needed some very supervised care during their early recoveries from the surgeries so they could come down. We had a very well-equipped physical therapy department here. And you see all of this equipment has been totally stripped. This is our conference room in which we had all of the decision made. We had dozens of meetings here between the medical staff and the leaders of the hospital, the administrator and his crew, and also the Board of Trustees, along with the representatives from the Vidant organization, University Health Center at that time. So we spent many of hours in here making all the plans as to how we would have an affiliation with University Health Systems and improve our lot as far as being able to provide health care. And we put it all on paper, and everybody signed that paper and that contract. However, every part of the contract has been disbanded as if you had torn the entire contract up and thrown it away. It paid no attention to it whatsoever. They haven't been taken care of or maintained very well.
You mean in the last 2 years?
Yes, correct. Mm-hmm. This is where moisture and mold and mildew has come in. And for that to have happened, we had to have a whole lot of increase in humidity, or either you had to have a leak on the roof that went down behind the walls. What's happened is they've actually knocked down some of the plaster and shut the door and did not repair it and fix it.
Do you know when this happened?
Since Vidant has taken over, these rooms were not like this when they came in to take over. These rooms were not full of mold and mildew, and there you can see yourself that these have been inadequately maintained. We did not have a whole lot of what you see with the mold and mildew and the cracking of the walls and the sheetrock and etc. However, you have to address it quickly. Anytime you have an area that is showing mold and mildew, you seek the leak and find out where that moisture is coming from, because as long as you've got moisture in this environment we're in, you're going to have mold and mildew. I've had 2 previous tours of the facility since I left the staff a couple of years ago, and they just simply did not do any additional repairs and had plans on closing the facility anyway, and didn't want to take the time to fix it. Mm-hmm. Down here is all patient rooms, and then this end of the hall has to do with your intensive care and emergency care areas. So these